Hey everyone, it's Wednesday, time for Wisdom Wednesday. Thought I would follow up this week with a little bit more information about semaglutide and the peptide that we spoke about last week. I did have the opportunity to go to my peptide certification course over the weekend, and there was lots of great information. But I think the thing that I really wanted to try to drive home this week about particularly this peptide and really any other peptide that we will talk about as we go forward, is that the important part of all this is that when you are doing this, it's really important to make sure that you have a great foundation regarding your nutrition and your exercise. These things are signaling molecules. They are basically messengers to the body to help the body when something is high to lower it, or if it's low to raise it. And so it helps to bring balance into the body. But if we're not doing our part and just continuing to live lifestyles that are not really helping create health, then we're really not going to see any benefits. And particularly with this one, in the studies with semaglutide, the patients were put on a calorie restricted program. They were asked to take in 500 calories less and to move about 150 minutes a week. So as you can see, it was not just live your life like you've been living it and reap the benefits of 15% weight loss over a year or so. So it's important to know, and a lot of the talking about this particular peptide over the weekend included this information, but also the fact that laying this groundwork sets up for a marathon and not a sprint. So this is not something that's going to happen overnight. You're not going to see that 30 pounds of weight loss necessarily very quickly. Now, for those people who do have a lot to lose, perhaps you will see that type of weight loss initially. But for most people who are just trying to get that extra 10 or 15 pounds off, this is something that we want to stay very low dose on, not push it to the maximum initially, because there are side effects. And a lot of the really experienced physicians who have used this quite a bit warned against trying to push the dosage of this particular peptide quickly, that you want to stay low and go slow with this, because it does reduce gastric emptying. Therefore, you feel full longer. It's definitely going to help with blood sugar issues and control of insulin. And as we spoke about last week, there were so many multiple benefits to the brain. It's going to help increase glucose uptake in the brain, but in a way that creates more energy and helps people feel better, but also protective. It's not going to set you up for long-term problems, say increasing risk for Alzheimer's, et cetera, which we consider type 3 diabetes. So the FDA has approved this just strictly for weight loss, even though this is considered a diabetes type medication. It has been used in some form or another for that, but specifically has been approved by the FDA for weight loss and does have some really great benefits. Now the question becomes too, do I have to stay on this for life? And there is certain aspects of this from some of the studies that when you do come off, people do gain weight. So it's perhaps something that people can stay on for a long period of time at a much reduced dose. For instance, rather than once a week, maybe every 2 to 3 weeks, you take a very low dose just to help maintain weight loss. And it's important that you use this as a tool during your weight loss to help reset some of your ideas about food and understanding that we really do take in more fuel than we need, and that's why we have all this storage. So I hope that people who go this route as a tool for weight loss find that it's important to begin to work on trying to reduce how much you eat, and perhaps looking into fasting, etc., for ways to look at maintaining weight loss. Also, I think that with the weight loss, the movement is as important as just eating less. So even though exercise in and of itself does not attribute specifically to weight loss, it does help with insulin control. And as we talked 2 or 3 weeks ago, just doing a 5 to 10 minute walk after each meal helps to reduce insulin spikes, and it really helps drive that glucose in the cell, so it's utilized right then for energy in movement and makes a huge impact. But 150 minutes of exercise a week is what's recommended, and this can be in any shape, form, or fashion. So if you want to do 3 10-minute walks every day, you're going to have that taken care of easily. But I do think that we've talked a lot about sarcopenia and muscle loss. You want to maintain muscle, so doing a day of upper body, a day of lower body, and a day of core every week is certainly something that I would recommend. Doing high intensity interval works, whether you're doing a 4-minute Tabata or you're doing a 20-minute HIIT type sprint exercise where you're doing 8 2-minute intervals. That type of HIIT workout can be very effective as well. But these are really good to get heart rate up and help long-term continue to burn energy, much better than just a steady state of, say, an hour of cardio. So hopefully I've given you a little bit more information than just taking this injection once a week and thinking the weight is just going to fall off. It does require effort, and it does require investment on your time. Now, there are a few other things that you can do. There is the opportunity to, if you are diabetic, and we're really working on metabolic numbers, using low-dose lysine, perhaps another type of peptide called oxytocin has been helpful, utilizing things that help lower inflammation. Some of the thymosin or thymus type either bioregulators or peptides have also been helpful by lowering inflammation. And then using another type of peptide called BPC 150, that's body protection type of a compound, will help heal the body while you're removing inflammatory foods and helping heal the gut. So there are a lot of other ways to approach this besides just the peptide of the semaglutide, although for many folks that's really all you need to do. Hopefully this has given you a little more insight, and if not answered all your questions, you can certainly begin your journey of vetting this and understanding it. And if you have questions setting up an appointment with us, we're happy to help you with that. And I hope to see some of you soon. We are working through and getting our patients set up on their protocols. It seems to be something I think I'm very excited about, because I do think that this is an example of a type of medication and or peptide that really is going to have great value as we move forward into the future, as far as really helping people not only lose weight and get to a healthier place. It's all about getting to a healthier place, not just the weight. It really is creating health by making you less insulin resistant, more insulin sensitive, helping you control your sugar numbers so that we reduce not only weight issues, but also hopefully maybe by doing this, reduce your risk for cancer and other long-term chronic illnesses. Hope you all have a great week, and we'll continue on this journey in the weeks ahead as we talk about more peptides. Have a great week.